So LASIK eye surgery is the most common surgical treatment that we do today to correct a refractive error, and that can be myopia, nearsightedness, hyperopia, farsightedness, or astigmatism. And basically what we do is to put the shape of one's glasses right onto the cornea, the clear front window of the eye, to put it in focus. Now, we started with LASIK actually in 1985 here at Minnesota Eye Consultants. That was more or less 25 years ago. And so we participated in the development of the technology. And when we first started, we actually used an operation called PRK, or photorefractive keratectomy, which we would reshape the cornea on its surface. And we still do some of those, but the disadvantage is the visual recovery is slower, and there's some discomfort while the eye is healing. What we learned is that we can raise a thin flap of the cornea and do the reshaping in the center of the cornea, and then put the natural surface of the eye right back in place. And that allows very rapid visual recovery and minimal discomfort. And so that's become the most common procedure, about 85% in the United States. And we've just continued to evolve incremental improvements ever since 1985. And the most significant recent ones are we can now make the flap with a laser rather than with what we used to call a microkeratome, which used an oscillating blade. That's made the surgery safer, and it's also enhanced the outcomes as far as the percentage of patients who get 20/20 vision and reduced the number who need a second treatment. So it's basically made it safer, but also more effective. The other thing we've learned to do is to measure the fine details of the refractive surface of the cornea. And the cornea is much like a fingerprint. Everyone's cornea is slightly different from someone else's. And we've learned how to customize the treatment to the specific patient, more or less able to remove even the tiniest aberration of the eye to create a higher quality of vision again. And again, that's increased the number of patients who achieve 20/20 vision, but it's also reduced one of the side effects we used to have, which is some reduction in quality of vision at night. So intralaser, custom wavefront driven LASIK is really the best procedure for today, and the one that we recommend to all of our patients.